Have you ever done, like, exactly what you were supposed to do, followed every rule to the letter, and still felt like you committed an unforgivable sin?
Oh, man. It is a question that completely stops you in your tracks.
Right. Okay, let's unpack this. Welcome to the deep dive.
We are thrilled you're joining us today because, well, what we have on the desk in front of us is something that might completely reframe how you view the hidden, often devastating costs
Yeah.
of just doing your job.
Yeah, it really shifts the whole paradigm.
It really does. So our source material today comes from the Clinical Notes and Service Models of Coping and Healing Counseling, or CHC. They're a telehealth therapy practice based out of Georgia.
Right.
But, we aren't just looking at their service menu. The core of today's mission is to dissect a really specific, profound psychological concept they've highlighted. It's called moral injury.
Such an intense term.
It is, and we're going to explore what it actually is, how it secretly differs from trauma,
Yeah.
and how it completely upends the lives of people working in these high-stress systemic roles. This matters deeply for you, the listener, because, we currently live in a world of absolute information overload regarding mental health.
Oh, absolutely. So much noise out there.
Exactly. The vocabulary we use is expanding, which is great, but the danger is that we often use the wrong words for our pain. And, if you cannot name the wound accurately, you just can't treat it.
You're treating the wrong thing.
Right. Understanding the distinct, incredibly specific language of moral injury is a crucial key to actual healing. It gives us a framework for a type of suffering that honestly just goes completely ignored by standard medical diagnostics.
Wow. So to even begin talking about symptoms or treatments, I feel like we first need to define the exact heartbreaking paradox at the center of this condition.
Yeah, we have to start there.
Because the source material explicitly points to a few specific professions where this just runs rampant. We're talking healthcare, emergency services, education, and child welfare.
Those are heavy fields, high stakes.
Right. Fields where individuals are required to follow very strict protocols. But the injury occurs when following that protocol perfectly is exactly what forces the person to lose a piece of their humanity.
And that's the paradox.
It's like playing this incredibly high-stakes game where following the rule book perfectly is exactly what forces you to lose, a piece of your own soul.
What's fascinating here is the mechanism of the injury itself. The term moral injury originally gained traction in military contexts.
Oh, like soldiers in combat.
Exactly. To describe soldiers who had to make these impossible, soul-crushing choices in war. But what our source material reveals is that this exact same psychological wound is happening every single day in our local schools and hospitals.
That is just wild to think about.
It is. We are talking about the profound psychological weight of having your own personal moral code break precisely because you obeyed a professional protocol.
Okay, let me push back on this a little bit, though. Aren't we just sort of splitting hairs here? Isn't moral injury just a trendy academic way of describing severe burnout or maybe standard depression?
A lot of people ask that.
Because, people get tired, systems are broken, the work is hard. Why do we need a whole new label for feeling terrible about a really stressful job?
That is the exact skepticism many people have, but the biological and psychological differences are massive. Burnout is a depletion of energy.
Okay, so just running on empty.
Right. It's the feeling of having nothing left in the tank because you've been asked to do too much with too little. But moral injury is not a depletion of energy. It is a fracture of identity.
A fracture of identity. Wow.
Yeah, it's a rupture in your fundamental sense of right and wrong. You can recover from burnout with rest and better boundaries,
Yeah.
You take a vacation. You cannot sleep off a broken moral compass.
Ah, I see the distinction now. Because in those fields we mentioned, like nursing, teaching, social work, you aren't just filing paperwork. You are holding human lives in your hands.
Yeah, exactly.
So the protocol might say, you must discharge this patient into the freezing cold because their insurance only covers a 72-hour stay.
Which happens all the time.
Right. Or, you have to remove this child from their mother based on this rigid set of state metrics, even though your gut says the foster system will actually do more damage.
And there it is. You followed the mandate. You did your job flawlessly according to the institutional system.
Right.
But your personal internal compass is screaming that it was an atrocity against that specific human being. The injury lives in that dark gap between professional obedience and personal morality. You are rewarded by your employer for doing something your conscience considers evil.
Man, that is just devastating. Which I think leads us directly into the most crucial clinical distinction in our source material.
Yeah, this is the big one.
Because once you grasp that definition, the natural assumption is to view this intense distress through the lens of trauma. Like, when society sees a first responder or a social worker struggling with flashbacks, sleeplessness, emotional numbness, we just immediately label it PTSD.
Right, that's the default.
But the source material is incredibly explicit about why moral injury is not PTSD.
It all comes down to the core driving mechanism of the distress. PTSD is fundamentally built around fear and danger.
Fear and danger, okay.
Right. It's a biological and psychological response to a direct threat to your life or safety. Your nervous system literally believes it is still under attack.
But moral injury isn't about fear. The source states moral injury is built around guilt, shame, and the agonizing sense that something you did, or maybe something you failed to stop from happening, broke your own moral code.
Exactly. If we want to look at the mechanics of it, PTSD is a fire alarm that refuses to turn off because it thinks the house is still burning.
Okay, I like that analogy.
But moral injury is not a fire alarm. It is a structural crack in the foundation of the house itself.
Oh, wow.
Right? PTSD leaves you with the lingering feeling of, I'm not safe. Moral injury leaves you with the agonizing feeling of, I am not good.
I am not good.
Yeah.
That is so heavy. But if that is the case, consider the typical screening process at a standard mental health clinic today.
Right. Think about what that looks like.
A patient walks in, they're handed a standard mental health checklist on a clipboard. They check the boxes for intrusive thoughts, avoiding certain places, emotional numbness, insomnia.
Standard trauma symptoms.
Exactly. So how easy is it for a well-meaning clinician to mistake the paralysis of profound guilt for the paralysis of fear simply because the intake form just doesn't ask the right questions?
It is tragically easy. And this represents a massive systemic failure in modern psychiatric care, which, by the way, our source material is actively trying to correct.
Thank goodness someone is.
Yeah. A staggering number of people carrying moral injury never get the right treatment because they are screened for the wrong thing. If the clinician only asks, were you in physical danger? Or did you witness a threat to life? They're completely missing the ghost in the room.
And the ghost is the shame.
Exactly. And treating shame as if it were fear does not just fail, it actively harms the patient.
Wait, it actively harms them. How?
Let us look at the mechanics of traditional trauma treatment. A common and highly effective treatment for PTSD is exposure therapy.
Right, where you confront the memory.
Yes. The goal is to have the patient safely relive a terrifying moment so their brain can finally learn that the fire is out, that they're no longer in physical danger. Habituation takes over and the fear response decreases.
But oh man, if you use that tool on moral injury, you are just forcing them to repeatedly face what they perceive as their greatest moral failure.
Precisely. You are making them relive the moment they discharged that patient or abandoned that student without offering any mechanism for forgiveness.
You're just torturing them at that point.
Basically, you are showing the brain that the fire is out, but as we establish, moral injury is a structural crack. Showing them a fire extinguisher does absolutely nothing to fix the foundation.
It's the wrong tool entirely.
In fact, it just makes them stare at the crack in the wall until they feel even more monstrous. They walk away from therapy feeling more alienated than when they walked in.
Okay, we clearly need to pivot to what we should be looking for then. Since people are being funneled into the wrong diagnostic boxes, how does moral injury actually manifest in someone's everyday life, according to the source?
The notes highlight a really devastating progression. First, it presents as exceptionally harsh self-judgment. But notice how it operates. The judgment bypasses the act itself and lands entirely on the identity of the person.
So it's not about what they did.
Right. It is never, I made a difficult choice because the hospital was understaffed and I had no resources. It immediately becomes, I am a failure. I am a bad nurse. I am a corrupt social worker. I am a toxic person.
It just completely consumes their identity.
Totally. And from there, the source notes it manifests as a profound loss of faith. Losing faith in an employer, a chosen profession, leadership, or even just one's own instincts.
Here's where it gets really interesting, because what you were describing is a radical leap from the internal to the external.
Yeah, it doesn't stay contained.
Right. A deeply personal moral crisis doesn't just hurt the individual in a vacuum. It literally causes them to lose faith in the very systems they dedicated their lives to building.
Exactly.
Imagine a teacher who viewed education as, like, a sacred calling. After being forced for years to push struggling students through standardized testing metrics while ignoring their actual needs, that teacher doesn't just quit.
No, it's bigger than that.
They experience complete soul-crushing disillusionment with the entire concept of the public school system.
And this systemic disillusionment paves the way for the final manifestation noted in our material intense, impenetrable isolation. The source describes it as feeling like the world stopped making sense in a way that you simply cannot explain to, and I quote, people who weren't there.
People who weren't there. Man, that phrasing is so vivid.
If we connect this to the bigger picture, the divide between the injured person and the rest of society is massive, and ironically, it is paved with good intentions.
What do you mean by that? Good intentions.
Well, think about it. A paramedic tries to explain to their spouse why following a specific triage protocol broke their heart. The spouse, trying to be supportive, says, hey, you were just doing your job. It's not your fault. Don't worry about it.
Oh, which is probably the worst possible thing you could say to them.
Because it entirely dismisses the profound moral weight of what they are carrying.
Mm-hmm.
The injured person feels like they have participated in something evil and their loved one is brushing it off as a clerical duty.
Wow, yeah.
That disconnect fuels the harsh self-judgment. The person decides, well, if my spouse doesn't see how wrong this is, if society thinks this is just doing my job, then I must be the one who's broken. I am the bad one. They internalize the systemic failure as a personal defect.
This is incredibly heavy. And, if you are listening to this and recognizing yourself or maybe your partner or a colleague in these descriptions, the immediate question is, what do we do about it?
Right. We can't just leave it there.
Recognizing this devastating condition is only half the battle. We need to shift gears and look at the actionable solutions and the clinical infrastructure highlighted in the source material.
The good news is that we are not entirely in the dark here. There are approaches built specifically to address this. The source explicitly mentions 2 treatments.
Okay, what are they?
Adaptive disclosure and acceptance and commitment therapy, which is widely known as ACT.
Okay, let's break down the mechanics of those, because as we established, you cannot just throw standard trauma tools at this. How do these therapies actually work to fix a broken moral compass?
Let us start with acceptance and commitment therapy, or ACT. The philosophy behind ACT is that you cannot medicate a moral wound. It is not simply a chemical imbalance, it is a philosophical rupture. Instead of trying to change the past or arguing with the thought that you did a bad thing, ACT helps the patient accept the painful reality of what happened.
Wait, accept it. Like, just be okay with it.
Not exactly. The therapist helps the patient realize that their immense guilt is actually proof that they still possess good values. If they were truly a bad person, they wouldn't feel the guilt.
Oh, okay.
Yeah.
That's a huge perspective shift.
From there, the therapy focuses on committing to actions in the present that align with those core values, rather than being paralyzed by the past.
So it's about shifting the focus from, I failed my values yesterday, to, how do I serve my values today? That's powerful. What about adaptive disclosure?
So adaptive disclosure was designed specifically for moral injury, initially for the military, but now adapted for civilians. It involves the patient revealing their perceived unforgivable act to a compassionate, non-judgmental authority figure, usually the therapist.
No.
Often, it involves guided imaginary dialogues with a forgiving moral authority, or even the person they feel they wronged. The mechanism here is to allow the patient to process the intense grief and shame, contextualize the event within the broken system they were operating in, and find a pathway to self-forgiveness that doesn't feel like just letting themselves off the hook.
But before anyone rushes out to try and implement this on themselves, the notes come with a very explicit, bolded warning.
Yes, this is crucial.
Sorting out whether you are dealing with moral injury, PTSD, or a complex combination of both is strictly a job for a licensed clinician. It is not something for an online self-assessment or a weekend retreat.
That warning cannot be overstated because these conditions overlap so closely in their visible symptoms, like the sleeplessness, the anger, the withdrawal. It requires a trained professional with the right diagnostic vocabulary to carefully disentangle the threads of grief, trauma, and moral injury.
And if you want to see how this looks in practice, the source we are using today, CHC Therapy, outlines a really fascinating architectural solution to these barriers on their platform.
Yeah, their setup is very intentional.
What I find so compelling about CHC's model is how they have engineered their business to actively disarm the isolation and friction that moral injury creates. According to the source, they operate a 100% HIPAA-compliant telehealth model, serving all 159 counties in Georgia.
When dealing with this specific type of injury, geographic reach and the method of delivery are vital components of the treatment itself.
It's a total game changer. We just discussed how moral injury causes intense isolation. People retreat inward.
Right.
If a burnt-out educator is already too exhausted and disillusioned to leave their house, telling them they have to commute 45 minutes across town, sit in a sterile waiting room, and fill out a mountain of forms is a massive barrier.
It's just not going to happen.
A secure video telehealth model eliminates that geographic friction entirely. You don't have to leave the safety of your home to start repairing the foundation.
The clinical infrastructure literally meets the patient exactly where they are.
And then they tackle the financial barrier, which is huge. Public service roles like teaching, social work, emergency services, they are notoriously underpaid.
Unfortunately true.
Meaning, the people most susceptible to moral injury are often the least equipped to afford long-term therapy out of pocket.
Exactly.
CHC's model highlights that Medicaid patients have a $0 copay. Zero. And they accept a wide range of major commercial insurances, bringing the cost down to a fraction of traditional out-of-pocket rates, like $10 to $40.
That's remarkable.
By making the financial entry point highly accessible, they are removing the secondary anxiety that often prevents people from seeking help in the first place.
But as we know, accessibility doesn't mean much without the correct clinical expertise. The source details their team structure, which includes over 15 licensed therapists. What is critical is the specific makeup of that team. They have LCSWs, LPCs, and LMFTs. That's licensed clinical social workers, licensed professional counselors, and licensed marriage and family therapists.
Okay, so why does having that specific, diverse alphabet soup of licenses matter so much for treating something like moral injury?
Because moral injury rarely stays contained in one area of a person's life. It bleeds out. A multidisciplinary team offers different lenses for treatment.
Give me an example of that.
Well, a licensed marriage and family therapist might approach the profound isolation aspect differently, focusing on how the patient's silence is fracturing their marriage and helping the spouse understand how to actually support them.
Rather than just saying, you were just doing your job.
Exactly.
Right.
Meanwhile, a clinical social worker deeply understands the systemic community failures that caused the injury in the first place, and they can help the patient contextualize the broken protocols they were forced to follow.
That makes incredible sense. You are attacking the problem from both the institutional side and the intimate family side.
And the source also emphasizes that their team is diverse and culturally competent.
Which has to be important here.
Very. When you are attempting to heal a person's fundamental sense of right and wrong, you must understand the specific cultural framework, religious background, or community values that their internal compass was built upon in the first place. You cannot guide someone towards self-forgiveness if you do not understand what they consider unforgivable.
Which is exactly why they have built a holistic net to catch people who are falling through the cracks of a rigid system. The practice offers individual, couples, family, and teen therapy alongside life coaching. And they treat a wide spectrum of overlapping issues like anxiety, depression, trauma, and grief.
It is a comprehensive ecosystem designed for a highly complex problem.
It is exactly the kind of nuanced, accessible infrastructure that modern mental health care desperately needs. So what does this all mean? We have covered a lot of ground today, moving from the rigid, impossible mandates of high-stress jobs to the profound architectural difference between a fear-based trauma and a shame-based moral injury.
It's a lot to take in.
It is. And finally, we got into the mechanics of how therapies like ACT actually rebuild a shattered identity.
To connect it back directly to you, the listener, whether you are an educator navigating impossible standardized testing mandates, a nurse dealing with heartless insurance protocols, or just someone trying to understand a loved one who comes home from those jobs looking completely hollowed out.
Yeah.
Recognizing that psychological distress isn't always fear is paramount. Sometimes it is a fractured moral compass. And acknowledging that reality, naming the wound correctly, is the very first step to true empathy and ultimately to healing.
It changes the entire conversation from what is wrong with you to what were you forced to do?
It raises an important question, one that builds on everything we have explored today. We have established that moral injury so often occurs precisely because people are following the mandated rules.
Right.
So could the rising clinical awareness of this condition eventually force massive institutions to completely rewrite their rulebooks?
Oh, wow.
Could accurately diagnosing moral injury be the catalyst that finally shifts the crushing burden of doing the right thing off the individual's conscience and forces it back onto the system itself?
That is a deeply provocative thought to sit with. Because if we ever get to that point, maybe we won't need new diagnostic labels to see where the system is broken. Maybe the murky waters finally start to clear. Thanks for diving deep with us today. We'll catch you on the next one.